These videos are not intended to replace the expert advice of your health professionals. Please note, not all care challenges discussed occur for everyone with MND. The strategies provided are not extensive.
MND affects the nerves that control the muscles in our mouth, our throat, and our breathing muscles. Some of the changes that somebody might experience is weakness in their lips, which causes spillage of the food or fluids out. They can have jaw changes that make chewing becoming a lot more effortful, or tongue changes that affects the way that they manipulate and move the food in their mouth to be able to swallow it down.
From what we see, we're looking at, I guess, the more functional aspect of eating. So what we see is the impact on how their arms are working and their ability to feed themselves, or their ability to hold cutlery effectively and then bring it up to their mouth. Maybe the environment that they're eating in, so the setup of the table, the chair, may not be effective to facilitate eating.
Probably the fatigue, that can really impact somebody's ability to manage the task of eating, but also the desire to eat.
So some of the signs that somebody's having swallowing difficulties include coughing, clearing of their throat, or feeling short of breath after meals. You might also find that chewing foods is getting harder or more effortful. You might be feeling like there's residue in your throat.
And I guess noticing weight loss as well, if they're, I guess, not able to sort of eat and get that nutrition.
When food, fluid, or saliva goes down the wrong way, that term is called aspiration. So the throat breaks up into two pipes. One of the pipes goes down towards the stomach and the other pipe goes down towards the lungs. There's lots of protective mechanisms that our body has in order to prevent the food or fluid or saliva from going down towards the lungs, but it can happen. It can be very serious when a person is aspirating their food or fluids or saliva, and can lead to chest infections or pneumonia or be life-threatening. So we want to do everything we can to reduce the risk of that happening. So one of the most important strategies to do is to brush your teeth twice a day. So using a toothbrush and toothpaste, you brush all sides of your teeth, on your tongue and inside your cheeks. Mouth bacteria, when aspirated, is the cause of chest infections or pneumonia. So if we can keep the mouth really clean, you're reducing your risk of infection. How you eat has a really big impact on the safety of your swallowing. So you want to make sure that you are sitting upright in a comfortable position, not leaning too far back. You want to make sure that your chin is neutral to the floor. So some people might be experiencing neck weakness, so they might be tilted back slightly in a chair, but their chin is still in a neutral position. So you don't want to be too far leaning back or too far forward. Often people find sitting up in a chair can get you into that position a lot more easily than if you're sitting on the couch or sitting in bed. Take small mouthfuls, chew really thoroughly, start to swallow once or twice between mouthfuls if they feel like there's any residue. Swallowing changes can also be impacted by fatigue. So you might find that you need to move your main meal to the middle of the day because you're finding that your swallowing function is getting a bit tired towards the end of the day. Another strategy that can be helpful is not to talk while you're eating and drinking. Some people might find that they begin to cook their meals for a little bit longer so that they're softer.
We do know that softer textures are easier to chew. I mean, if you compare eating a steak versus shepherd's pie, it's a lot easier to eat mince than it is a steak.
Or they might cut it up into bite-sized pieces. Other people find adding a sauce or a gravy on top of their meals helps to lubricate the food a little bit more and helps it to break down more easily so they can chew and swallow it down more effectively. Some people might also find that naturally thickened drinks might become a little bit easier to swallow. So that can be like pear juice or tomato juice. A really helpful strategy is to keep a log of what's happening. So you might write down, I had a coughing episode while I was drinking my coffee in the morning, or I was eating rice and it caused me to cough for 5 minutes. Keeping a log or a diary can be really helpful to bring to your speech pathologist to provide really clear, objective information in terms of what's happening. Often, when you implement these safe swallow strategies, it can enable you to continue to eat and drink the things that you love for longer.
Early on, setting up the environment to promote independent eating. So having a chair that's comfortable for them to sit in, that's high enough for them to sort of be able to reach the plate and their cutlery effectively.
It can be really important to set up the environment to make it a positive place.
Whether or not that's putting on a really nice playlist that person likes, having it in an environment where there's no sort of craziness around, it's really calm, there's time to eat.
They might like a certain scent in the room, they might like a certain noise level, a certain temperature. We really want to associate that with a really positive environment.
Some other things that the carer can do is chopping up the food into smaller bits if that's what the client needs. Doing that all before dinner time, so that at dinner time it's about eating versus having to sort of do all those additional things.
I've had families where going out to restaurants is actually a really important part of their relationship. So I've had carers say to me they ring ahead and talk to the restaurant about, can you make this food modified? Can you mince it? Can you vitamise it? Other carers have done things like having a portable blender that they take with them and they blend it themselves there at the table because that's how their person needs their food. Adapting to the changes in the way people eat, I think, is really important, but really possible too if you just sort of think ahead.
So if you are noticing any coughing or clearing of your throat or shortness of breath after eating or drinking or in between meals, which may be on saliva, then reach out to your speech pathologist and complete an assessment.
It's just important that clients and carers sort of reach out for support when they're noticing signs of difficulty, whether it is using standard cutlery to feed themselves, or they're noticing changes to someone's swallow and things of that nature. It's important that they do ask for help early on. There are small bits of equipment that can be implemented early on, like different cutlery and things like that. If they're drinking, so different cups or modified cups can be implemented as well. There's a cup that's a bit more lightweight or have a bigger handle that's easier for someone to grasp and pick up. If that's a goal of theirs to continue preparing their own food for as long as possible, there is lots that we can explore in the kitchen to promote that independence.
There is also fluid thickener that helps thicken the fluid so that they move that little bit slower, so the body has that little bit more time to respond when you're swallowing it. And checking in with your speech pathologist about whether that's something that's necessary for you can be really helpful. People with MND have the choice about whether they receive a PEG tube. A PEG tube can support somebody to have an alternative means of nutrition and hydration.
It's a tube that's inserted into your stomach, and it allows for feeding straight into your stomach without having to eat food, basically. It takes the pressure off meal times. If you have to get through so much food, it can be quite stressful, especially if there is some impairment with chewing and swallowing.
Eating food was quite important. As the condition worsened, he was quite thankful to have food by the PEG.
People with MND can experience saliva changes, so that might be difficulties with holding the saliva in their mouth, so they might experience some drooling. Some people might also experience some thick, sticky saliva in their mouth and their throat. And if you're experiencing changes like this, then contact your speech pathologist, because there's lots of different strategies that we can do to support your comfort with your saliva management. I think it's really important to keep the person living with MND at the center of the care that we provide, and we want to support you to have as much quality of life as possible.